Welcome, Tina Allen, to the World Massage Conference.
Thank you, Scott. It's great to be here.
We are so excited about your presentation today, Tina. We've had so many wonderful presentations with the World Massage Conference this year, and earlier this evening we had a presentation about massage in hospitals and about the research that's being done on touch, and it was specifically about children in hospital, but also the treatment of their parents and how it's been shown that by helping the parents are better able to help their children. So I'm very interested in your presentation, so please go ahead.
Great, thank you. So for a moment, I just wanted to take this quick moment and thank everybody at the World Massage Conference, the organizers, and everyone who's been working. Obviously, I can tell by how many wonderful presentations you've had day and night on putting together such a wonderful body of all different modalities and research and history of massage and just bringing us all together as a community. So I'm really glad to take a part in this and be part of this, just a landmark area for massage therapy. So thank you all for all of your work on this too.
And we're happy to have you, Tina.
Great, thank you. On the first slide, I'm just going to leave it on the title slide for a moment. You might be wondering, why did I even title this presentation, What is Pediatric Massage? And when I was coming up with putting together this presentation on pediatric massage, it took me a moment to think, what should I call it? Should I call it pediatric massage, massage for children with special health care needs? What would be the most appropriate? And it seemed most appropriate to call it What is Pediatric Massage, because that's the question that I'm asked the most often whenever I'm talking to people about massage for children or massage for children with special health care needs, and I bring up pediatric massage. The first question I'm often asked is, what is it, and what is it about, and they don't know what it is. As massage therapists, body workers, and other healthcare practitioners, those of you that are listening to this presentation tonight, massage therapy, to you, you understand what that is, and you might have an idea about what pediatric massage is, but to people that we talk to in everyday, outside in the world, just everyday settings, they're not very familiar with all of what massage is or does, and especially not about pediatric massage. So it just seemed fitting that I start there. And so on my next slide, on slide number 2, we're just going to start from the beginning and define what pediatric massage is. So on my first bullet point, I have pediatric massage therapy is the manipulation of soft tissue provided with the intent of promoting the health and well-being of children. And that seems like, a definition of massage therapy in most modalities of manipulating soft tissue, so touching the skin, getting that skin-to-skin contact. And, of course, our intent almost always is to promote the health and well-being of our client. But in this case, obviously, we're talking about children. And the application does vary depending on a child's health care condition. So with pediatric massage, sometimes we're thinking about working with healthy, well children. So children that are in our own lives, infants, young children, children that are school-age, children that are of adolescent age that are healthy and well. But pediatric massage also lends itself to working with children with special health care needs. And my focus when I'm working with children is to think about, and when I'm training pediatric massage therapists, is to think about giving them techniques and tools that can be used with healthy, well children, but also with children who have special health care needs, and to use individual techniques that are unique that help each individual health care condition. So it's important that we think about, like we would with any of our clients, approaching them individual and unique, but also thinking about the application of pediatric massage depending on that child's health care condition. On our next slide, we actually have a piece that Scott did read to us, and I'll just share this with you. I think this is important. To a child who has been hospitalized or diagnosed with a debilitating medical condition, their symptoms are often accompanied by pain, anxiety, loneliness, and fear, which is true. When you are a child, no matter your age, infants slightly different because they may not be verbal. And that might be different for us to understand how they're feeling if we're not very in tune with reading their cues or picking up on their nonverbal body language. But for other children who are verbal, who can speak to us in a language that we understand easily, it makes sense, and we can notice when they are hospitalized or they do have some type of a medical condition. They are often met with some pain either from their condition and or from the treatment that they're receiving. They may have anxiety or fear around those types of treatments, and loneliness. If you're hospitalized, for example, you may have loneliness. You might not be around all of your peers, your friends, your siblings, your caregivers. You may be